single fraction SABR for lung primaries and lung oligometastases appears to be safe and effective. So yeah, we had a very large cohort, and it's 3 institutions with pretty substantial experience of using this technique. So Peter Mac, Cleveland Clinic and Roswell Park all ran kind of landmark randomized trials in this space. But each of those trials had only about 100 patients in it. So this was a much bigger data set. So what we saw is very low toxicity rates, which was really encouraging to see. Now, it's always a little bit of a caveat. Retrospectively, trying to assess that is a little bit harder than in a prospective manner. But we saw kind of 3% or less grade 3 or above adverse events. Slight difference between the oligomets and the primaries in terms of grade 2 and above. We had about 15% grade 2 and above for primary non-small cell lung cancer, and only about 7% grade 2 and above for the oligometastases. Probably comes down to better pulmonary function in the oligometastatic cohort compared to a primary cohort, because most of the additional adverse events seen by the primaries were pneumonitis, which possibly relates to just poor baseline lung function. In terms of other differences between what we saw, different patterns of failure after treatment. So local control was excellent in both groups, 90% plus at 2 years, and didn't really differ hugely either among primaries or metastases. What was different was the pattern. By far and away, the most common first failure event in the primary pattern was actually death. So most patients didn't relapse afterwards before dying of anything else. In the oligometastatic setting, it was almost always distant relapse was by far and away the most common. But isolated local regional failure was really rare, which was a very reassuring finding. Overall survival was slightly longer in the oligometastatic setting than after primaries, just over 4 years compared to about 3.5 in primary. So we did see some differences, but in terms of the local effect, I don't think we really saw much difference. I think what it's telling us is that the technique does appear to be effective. And again, the safety we are pretty confident that it's a safe treatment based on these results. Yeah.